Hi and welcome to my YouTube channel. My name is Nasan and today I'm here to talk about challenges with the breastfeeding or some of the challenges that affect breastfeeding. These challenges can be either from the mother's side or from the baby's side, and neither the side the baby is going to be affected to breastfeed. One of the challenges that affect breastfeeding is poor milk supply. This is when the mother is not able to produce enough milk for the baby. Ensure that you as a mother, you are taking in enough, you are taking balanced diet, you are taking a lot of fluid and healthy food. Therefore, you are going to increase your milk production. Ensure you empty your breast most of the time and fix your baby on the breast. The more you fix your baby on the breast, the more your body is going to produce more milk. Ensure that you room in and stay closer to your baby. Also, there is leaking breasts. Mother is leaking the milk all the time. You as a mother, it's going to make you feel like you have low self-esteem, or sometimes you feel embarrassed. Don't be. Actually, you can put on a nursing bra and ensure that you change the pad, the bra pad all the time, so that you maintain hygiene and reduce the chances of breast infection like mastitis. Another problem is breast engorgement. Breast engorgement comes about when the mother is producing a lot or more than the baby can empty, and therefore you'll end up engorging if you're not going to get other ways of producing this milk from your body. Ensure that you fix your baby on the breast most of the time so that you can empty your breast to avoid or to prevent engorgement. Also, as a mother, you can also work on pumping and storage. You can get a breast pump, you pump your milk, label very well and store in a freezer. Actually, you can store your milk for the longest time you can in a freezer, like about 5 to 6 months. But ensure that you write date and time so that the first in, first out, so that you don't use the milk that you produced yesterday and yet there is milk that was there like 4 months ago. Another problem that affects breastfeeding is now when there is an anatomical problem with the baby. There are some babies who are born with some problem that will affect their breastfeeding. Like if the baby is born with cleft and palate, baby will not be able to grab the nipple and suck out the milk unless that cleft and palate is corrected on time. Also, those who have big tongue, the tongue that occupies the whole mouth, they are not able to open their mouth very well and latch on the breast very well. There are also some factors like affect the chin or also affect the gum. These are some of the anatomical conditions whereby the baby are born with them. Unless they are corrected on time, it's going to affect breastfeeding. As a mother, you should not stop. You can always express your baby breast milk, and you can give maybe through a cup, spoon, or even if the baby is in the hospital, NGT tube can also be given. Also, there are what we call inverted nipples. There are mothers who have good breasts, yes, they are producing milk very well, but there is no nipple. The nipple is flat. When the nipple is flat, it becomes very hard for the baby to latch on the breast, and therefore, if the baby is not able to latch well, it is going to affect milk extraction from the breast. When you have flat nipple, you can use a breast pump to pump milk, and also breast pump will help to bring out the nipple at an extent. But meanwhile, you can use nipple shield. There is special shields that are made that you place on the breast near or around the nipple, and the baby will be able to latch on the nipple, the artificial nipple, and be able to suck out milk from the breast. Also, is what we call incorrect latching. Incorrect latching can affect breastfeeding. You have milk, the baby is willing to breastfeed, but you are not able to latch your baby well on the breast. There are latching techniques that I'll also talk about them. Latching techniques are very important. Ensure that your baby has latched on the breast very well. If you're not able, please always ask for assistance from the nurses or the doctors or the family members who are around you, so that you don't suffer. If your baby is not able to latch for some reason, always try to seek assistance from the people who are around you. Also, there's what we call sore nipple. Sore nipple is whereby improper latching or due to some reason your nipple has cracked, and the cracked nipples are always very painful, and this will always scare most of the mothers to continue breastfeeding or to opt not to breastfeed. Always it is uncomfortable, yes I know, but there is some ways that will help you reduce the the soreness of the breast. First, proper latching. When you latch your baby on the breast correctly, then it's going to help you reduce having sore nipples. Also, avoid using harsh soap on the nipple part. Just use simple soap and simple ointment, because if you use harsh soap is going to affect your it might crack or cause sore nipples. Also, ensure that you talk to your doctor to help you give you nipple cream to apply so that it enhance healing. But this one should not prevent you from breastfeeding. Just continue breastfeeding so that you don't get engorged. Also, you can get a mother who is having breast milk, but the ducts are blocked. Milk is there, but it's not able to. Milk is not able to come out. That's what we call a blocked milk duct. This one you can talk to a doctor. They can always advise on what to do, and don't keep quiet, because if you keep quiet, it's going to swell or it's going to cause even infection. It's going to cause what we call breast engorgement that I've already talked about, and it's not good. Also, ensure that you are in comfortable position when you are breastfeeding. When you are breastfeeding, ensure that you support your back. You are comfortable. If you are not comfortable, you are going to get tired easily, or you are not able to sit for a longer time because of back pain or discomfort. Ensure that you are very comfortable before you start breastfeeding. Also, ensure that before you start breastfeeding, your baby is fully awake and you have changed the diaper, the baby is comfortable, and now baby is willing to breastfeed. If this baby is in pain or wet diaper or is sleepy, a sleepy baby cannot breastfeed. As much as we say that breastfeed your baby frequently, actually ensure that it is between 2 to 3 hours. Ensure you are breastfeeding 2 to 3 hours, but not all the time 24 hours you are breastfeeding. Your baby needs time to rest. Your baby needs to sleep. At least for them to grow, they need to rest, to eat well, and to sleep. Therefore, ensure your baby is awake. Another factor that might affect breastfeeding is a fussy baby. This is a baby who is very irritable, cannot settle, crying all the time. You as a mother, you can also get frustrated because of this. I want you to be calm and focus on breastfeeding. Ensure that your baby is comfortable. Try to find out why is your baby irritable. You can do this by squeezing some milk from your breast, and now you can attach your baby, and now baby will know that there is something sweet that is coming. And also, ensure, as I already said, ensure that you have checked diaper, you have checked other factors that might be causing this baby to be very irritable. Large nipples. We talked about flat nipple. Now here we have large nipple that a baby is not able to latch on, larger than the baby can hold in the mouth. This can really affect. We can't correct God. This is what we have, but there is a way out. We can always pump our breast and give to the baby, maybe through the bottle or other ways. Also, you can use a nipple shield. A nipple shield is a special shield that is placed on the breast, and the baby is able to latch on the breast directly, and it will extract milk normally like any normal person. Also, a premature baby, a baby who has not reached term, has a problem to breastfeed, and that's why we usually encourage that we pump breast milk and feed the baby through the nasogastric tube or a spoon, or whichever method the doctor will decide. This is because they are not able, their muscles are not able to sustain breastfeeding, and also they end up losing a lot of weight because they burn a lot of calories, and at this time we are concentrating on weight. We want them to add weight so that they can be discharged and go home rather than staying in the hospital for a longer time. Therefore, for this baby who are preterm, we'll always encourage that breast pumping is the key. Also, there are some conditions like Down syndrome. Down syndrome is whereby there is problem with the muscle tone. The baby's muscle tone are weak. Always be patient with these babies. You need to be very patient. Teach them slowly how to breastfeed. Every day they'll be trying to get in something slowly by slowly. Try to pump and feed them, and also as you coordinate with the breastfeeding, they'll take longer than expected or longer than normal baby to learn how to breastfeed, but at the end they'll catch up. So you as a mother, I'll always say that you be patient with any child. Even if the baby is a normal baby but they are not able to latch on the breast or they are not able to catch up, remember that you and the baby, all of you are students, you are in the same class. So one of you will be number one and the other one will be number two. So if your baby is number one, then you are number two. You should accept. If your baby is number two, then you should be number one. You should be patient to allow this baby also to learn and reach at your level.